is Kayla Gordon. I'm in Professor Lloyd's Adult Health 1 Term 2 class. Today I will be demonstrating how to insert a basic IV. First, I will go ahead and implement standard protocol. I will be checking my physician's orders with my MAR and to see that I have the right patient and the right IV for the patient. Next, I will go ahead and set up all of my equipment for my patient. So first, I know that I'm going to need some alcohol swabs, a IV start kit, a blunt cannula, clean gloves, angiocath, tourniquet, extension setting, a dressing, a 10 milliliter syringe for normal saline, and tape. So first I'm going to go ahead and prime my extension tubing. So with that, I'm going to go ahead and attach my blunt cannula to my 10 milliliter syringe and draw back to the 8 mark. Insert this air into the bottle. Make sure I get all the way to the 8. Let's make it a little bit. Okay, so now that I have my normal saline, I'm going to recap that blunt needle, get my extension tubing ready. Go ahead and take that needle off and attach it to the needleless side of the extension tubing, making sure that it's tight. I'm going to go ahead and open up this and make it flow through so there's no bubbles. Snap it back. And I'm going to go ahead and put this back into the packaging to keep it clean. So next I'm going to go ahead and take all of my tape, equipment, and everything into my patient's room. Okay, so hi, my name is Kayla. I'm going to be your nurse today. Can you tell me your name and your date of birth? Thank you. Do you have any allergies to latex or alcohol, anything of that sort? Okay, good. Well, I'm going to go ahead and wash my hands. And we're going to be inserting an IV today. Did your doctor talk to you about that? Okay, well, I'll just go ahead and explain it. We're going to be taking a small needle and placing it into your vein so that it'll be open for medication administration. So first I'm going to go ahead and try and select a vein. So first I'm going to go ahead and palpate. Go ahead and select a vein. I want to make sure that I've got a good bouncy vein and that it's not cord-like or I'm going to make sure that it's not cord-like or anything. I do want to make sure again that this is not your dominant arm and that there is no fistulas or you've had a mastectomy on this side or a shunt. Okay, good. So again, back to the vein, we're going to make sure that one that's bouncy, not hard-like or cord-like. Make sure it's not distal to any other venous punctures or anything. So now I'm going to go ahead and select my vein. So now I'm going to go ahead and just clean this spot once so that I can mark it, knowing where I want to place my tourniquet. I'm going to mark it there. Okay, I'm going to take my tourniquet, place it 4 to 6 inches above my site. Making sure to tie it so that the skin does not rip. Okay, and it's easy to pull. I'm going to go ahead and check for the radial pulse. Okay, now I'm going to go ahead and perform hand hygiene again and put on my gloves. So since I touched where my site was going to be, I'm going to make sure that I just clean that again. Just put that there as well. Okay, and now I'm going to go ahead and insert the IV. So first I'm going to go ahead and prep my needle, making sure that it's intact and everything. I'm going to pull the skin taut, bevel up at a 15-degree angle. I'm going to insert the IV. Once I see the flashback, I will release the catheter and push it forward into the skin, retracting the needle, applying light pressure. I'll put this into the sharps. Next, I'm going to take my extension tubing. Before that, I'm going to pop off my tourniquet so we don't have too much pressure. The extension tubing, screw that on tight, open up my release, and just flush that with normal saline. Oh, first I aspirate it. I see blood, and then I'm going to go ahead and push that in. Okay, once it's aspirated or flushed, I'm going to go ahead and apply positive pressure, not letting that rip out, and clamping it back. It's not easy to do with gloves on while applying positive pressure. Okay, now I'm going to keep that right there. Go ahead and disconnect my tubing. Once that's clamped off, holding that right there. Okay, next I'm going to go ahead and apply my sterile dressing. I'll go ahead and just wipe this off. Place that there. So when applying my sterile dressing, I'm going to make sure that I don't touch underneath the site. I'm going to go ahead and write my name on the dressing because we don't ever want to write on our patient. I'm going to put the date, which is the 4th, my initials, and the gauge is a 20 INT. So I'm going to take this, put this out of the way, and I'm going to make sure that I put this over the site, but also making sure that it is over the hub as well. Alright, now that the dressing is on, I'm going to take my tape in a chevron fashion and secure it to the patient. Fashion. Go ahead and take another tape and secure that down. And one more to secure the tubing across to the side. Alright, now that our IV is on, we want to go ahead and make sure that we don't see any inflammation around the site, any phlebitis or anything, and I don't. I'm palpate it just to make sure that it's not too tender. I'm going to make sure that I go ahead and document my name, the patient's name, the fact that they have no allergies, the size and type of the INT or the IV, and the site where I put it. And I will also do how the patient tolerated the procedure and the patient teaching. Thank you.